Rachel is a 50-year-old woman who recently came to the emergency department at the hospital with chest pain. One of the hospital pharmacists meets with her to review her medications. The pharmacist asks about her use of alcohol to determine possible interactions with medication. Watch how the pharmacist uses the SBIRT approach to determine Rachel's use of alcohol and drugs.
Good morning, Rachel.
Oh, hello.
Hi, my name is Dr. Moore. How are you doing?
Hi, I'm feeling better this morning.
Okay.
Not too much yet, but...
Good. I'm glad to hear that. Well, I'm one of the pharmacists here at the hospital, and my job is just to review your medications and to see if there's any interactions that you're having. Would it be okay if I talk with you for a few minutes?
Okay, sure.
Okay, great. So I see that you're taking several medications.
The pharmacist reviews the medications and then asks 2 pre-screening questions to determine if Rachel is using substances that may interact with her medications.
Just once a day. Great. Well, I appreciate your time this morning. I have just a few more questions about your health. Would it be okay if I asked you those questions?
Sure, I don't mind.
Okay, thank you. I appreciate your willingness. The first question is, in the past 12 months, have you used any illegal drugs or used any prescription medication for non-medical reasons?
Oh, no, not at all. I don't use illegal drugs, and any medications I take are all prescribed by my doctor.
Okay, good. I'm glad to hear that. The next question is, do you smoke or use other tobacco products?
No, I quit smoking years ago.
Oh, good for you. That's a great accomplishment.
Thank you.
The last question is, when was the last time you had 4 or more drinks in a day?
Well, maybe last Friday, after a long, hard day at work. And sometimes I go out on the weekend with friends and drink, but it's never more than once or twice a week.
Okay.
Not that much.
Okay, it's usually about once or twice a week that you're drinking. Tell me more about your alcohol use. Tell me what you drink, how often, how much.
4, maybe 5 glasses of wine. Just a couple times a week, like I said. It's just not very often.
Okay. Is it okay if I share with you some information about your alcohol use?
Sure.
Okay. So as you can see here, these are some guidelines for drinking limits. For women, the recommendation for drinks per day is 3, and then for drinks per week for women, it's no more than 7 drinks per week.
7? Geez. That doesn't seem right. I mean, why, especially, the men, it's 14. I mean, shouldn't it be higher for women?
That's a good question. The reason for a weekly total limit is that drinking alcohol on a regular basis can increase your risk for accidents and other health issues. Also, women tend to have more water in their bodies than men, and because alcohol mixes with the water in your body, women tend to have a higher concentration of alcohol when they drink, and that can kind of put them at greater risk for organ damage, like the liver.
Oh.
What do you think about that?
Okay. Wow, I didn't know that. I certainly never knew about these drinking guidelines, but I haven't had any drinking problems.
Okay, so alcohol really hasn't had a negative effect on your life?
Mm-mm.
What are some of the things that you like about drinking?
Well, social aspects, getting out with friends. Like I said, after work or on the weekend, it's my social life.
Sure, I can see that. What are some things that you don't like about drinking?
The headaches the next day?
Yeah, sure. So on the one hand, you really enjoy drinking with your friends on the weekends, and then on the other hand, you're not a big fan of the headaches.
No.
Sure. There's one other concern that I saw after looking at your list of medications. Can I share that with you?
Sure.
Okay. So I saw that you're taking the heparin, which is a blood thinner, and is really good for preventing blood clots. Alcohol can also thin your blood.
Oh.
And drinking alcohol while taking a blood thinner can put you at risk for negative side effects.
Oh, wow. I didn't know that.
Well, my concern is about the interaction of the alcohol with the heparin. What do you think about that?
I guess I could cut back a little bit, but I wouldn't want to give up alcohol altogether. It's
Okay.
it's...
Let me ask you this. on a scale of 0 to 10, with 0 being not important at all, and 10 being very important, how important is it to you to cut back on your drinking?
Let's see. 4?
Okay. Why that number, not something lower like a 1 or a 2?
Well, I did hear what you said about the medication interactions, and I don't want to mess with that. And, several glasses of wine can be kind of expensive, so.
Sure. Why a 4 and not something higher, like a 9 or a 10?
Well, because I still do enjoy it as part of my social life, and it hasn't caused me any problems yet.
Sure, I can understand that. My recommendation is that you do cut back on your drinking, but it's got to be important to you. Would it be okay if I shared this information with your physician?
That's fine, sure.
Okay, great.
After negotiating a plan, the pharmacist shares the information with the attending physician. As part of the medical team, the pharmacist is a good resource to patients for understanding how alcohol and drug use can negatively interact with important medical conditions. The SBIRT approach is an effective tool to help pharmacists provide such information to patients.